Neither value nor efficiency is wholly objective. The idea that they are dies hard. Denunciations of inefficiency and waste are often nothing more than statements of a different set of preferences. Schemes to turn particular decisions or processes over to experts who will promote scientifically neutral efficiency are often simply ways of allowing one group of people to impose their subjective preferences on others.
In 2011, Mike and I had a meeting with Bill Gates where he asked us what needs to happen to take this idea of value-based healthcare to scale. And my answer, and Mike agreed, was that outcome measurement needed to become the norm so that people could and would focus on improving value by improving health outcomes. So we agreed that there needed to be an international effort to make this transformation.
The ultimate outcome, I think, is to increase transparency, to increase accountability, and to transition to a value-based system rather than a fee-based system. The template for what we ought to be doing is a value-based plan. The ultimate goal, which is value-based care. If you smoke cigarettes for 20 years and you get cancer, you are now taking from the pool. Well, and so are you guaranteed the same right, or is there also a duty?
I'm sorry. And you speak about Britain, that the health secretary, she said that it's okay for people to be denied medical care who have unhealthy lifestyles, such as if you're a smoker, if you're obese, then you should not be eligible for, or there's a real chance that you might not get the kind of treatment that you need because you are guilty of maintaining a lifestyle that affects your health.
Well, these people are closet totalitarians. There's just no question about it. I mean, they are so convinced that they know that what's best for us, and that we poor dummies that we are would never understand it. That this is the kind of stuff you can expect.
Before there was Medicare, before there was Blue Cross Blue Shield, seriously ill people in general were taken care of. In the 1930s or 20s, when my wife and I were growing up, and we went to hospitals, we never were asked, do you have an insurance company? We never were asked. We were taken, in an emergency, you were taken into the hospital and treated. And then later they would come around and try to give you a bill and try to find out how it was going to be paid. But today, you go into a hospital, you can't get treatment until you've delivered them 3 insurance cards or some assurance of financial responsibility. So that social feeling of responsibility for somebody who's seriously ill has eroded. It's not gotten stronger.